I'm Linda Snetselaar, Editor-in-Chief of the Journal of the Academy of Nutrition and Dietetics, and it's my honor today to have with me Ed Frongillo, who has done a lot of work in the area of childhood food insecurity. He is a professor and director of health initiatives in the Department of Health Promotion, Global Education and Behavior at the University of South Carolina. And he conducts research globally focusing on learning more about how to improve feeding, care, growth, development, and survival in children. This work with his colleagues has actually given a new voice to children's experiences in terms of food insecurity and why food insecurity is harmful in this particular age group. So Ed, I'm so happy that you could join us today, and we will get started with questions.
Hey, happy to be here, and thank you for the opportunity.
Surely, thank you. So the first question, why should we be concerned about food insecurity in children in the U.S.? We tend to look at the U.S. as a place where maybe that kind of thing doesn't happen, although we've certainly been seeing more of it during COVID. But if you would just give us your thoughts on that topic of why concern should be expressed when we're talking about food insecurity in children.
Well, going back to the late 1990s, two clinicians named Kleiman and Murphy published an article that called attention to an association between food insecurity in households and some outcomes in children of concern to pediatricians. And then around year 2000 or so, Catherine Alaimo, who was a doctoral student at Cornell University, did a brilliant dissertation where she used nationally representative data from the National Center for Health Statistics to examine how food insecurity in households was related to a broad range of child outcomes. And that work and some other work that followed shortly afterwards showed that when children are living in households that are food insecure, their school performance is worse, they have more behavioral problems, their physical health is worse, they experience stigma and shame as a result of food insecurity. And then in one piece of work that she did showed that among adolescents living in a food insecure household in the U.S. were 4 times more likely to have major depressive symptoms and 5 times more likely to be at risk for suicide. And this led us to think about how is it that food insecurity is affecting families and why we see these associations. And we came to the understanding that food insecurity, which of course has to do with food, does operate through what we could say a nutritional mechanism, because food insecure families may have poorer diets or less food, and then there may be consequences of that. But also that food insecurity is a very powerful, profound stressor on families and on the people in families. And so that's a non-nutritional mechanism. And it's through these paths that are non-nutritional, such as experiencing physical hunger, distress, and adverse family interactions and adverse social interactions, such as family conflict, worry and anxiety about food being uncertain, and feeling deprived and alienated because of their compromised food choices and non-normal ways of eating and having to get food in socially unacceptable ways. And so we think that these are the reasons why we see a tie to outcomes like a risk of suicide, because food insecurity is a stressor itself, but also a marker of stress from other forms of material needs insecurities, such as housing insecurity or financial insecurity.
It does go far beyond just food per se, and we're looking at many other factors that will certainly affect children when we talk about food insecurity. What do children experience when they're faced with food insecurity, and how do their experiences, very importantly, differ from those of adults?
Well, thinking about food insecurity from a sort of family or household and individual perspective goes back to about the late 1980s when the first work was done, interviewing people in families about their experiences. And the first interviews were done, and for a long time, the interviews were done with mothers. So what we thought we knew about food insecurity in families had come almost exclusively from mothers, because they were chosen because they were seen as, in traditional families, as the primary food managers. And they told us that food insecurity was a managed process, and that they, the mothers, acted to protect their children from being affected by food insecurity. But that way of thinking about it didn't square very well, didn't make sense relative to the kinds of outcomes that we saw associated with food insecurity that I just described. And so we started, about 15 years ago, started interviewing children about their experiences. A woman named Carol Connell in Mississippi, and then my colleague and I, Mariah Fram at my university, Jennifer Bernal in Venezuela, and a little bit later, Hala Gaddis and her colleagues in Lebanon, started interviewing children about their experiences. And what we learned from that is that children are aware of food insecurity in their family, physically, emotionally, and cognitively, and that they also take responsibility for food insecurity. They participate in adult strategies, they initiate some of their own strategies, and in many cases, especially older children, will overtly go out and try to generate resources to help the family in order for them to have enough food. And we heard a lot about these experiences and actions in our interviews. Sometimes children would engage in ways of trying to help the family that were very concerning, sometimes illegal. So what we got from this was that children, even very young children, know about food insecurity going on in their family. They have emotional reaction to it, and in extreme situations can experience physical hunger as a consequence of that. And then subsequent work, we found that adults often don't know about these experiences of food insecurity that children have, both because of lack of communication, but also because children hide their experiences from their parents. And in one study that we did, where we interviewed fathers, mothers, and children, fathers and mothers knew only about 40% of their children's experiences. So as a consequence of this, in the United States, at least, parents substantially underreport their children's experiences of food insecurity because they don't know about them. And work that we've done and work that was done by Jennifer Bernal in Venezuela show very convincingly that children's reports of their own experiences predict a wide range of poor outcomes for them much better than parental reports of their children's experiences predict. And the way we can understand this is that it has to do with roles of people, of individuals and family members trying to protect each other. We heard a lot in interviews about fathers saying, if they were the primary money earner, well, I want to make sure that my wife and my children don't have to even think about food. So I try to make sure that there's enough resources for that. The wife, the mother, would say, well, I don't tell my husband that we really don't have enough because I know he's working really hard and I don't want him to feel worse about that. So I kind of just keep quiet about that. And then the children would say, well, things like, well, they ask me if I've had enough to eat at dinner, and I always say yes because I know they're trying really hard and I don't want them to feel bad, but oftentimes I don't have enough to eat at dinner and I'm still hungry. Or an older child might say, I try not to eat all that I want to eat because I want to make sure my younger brother or sister has enough to eat. So what we see is a picture of family members trying to protect each other, and sometimes being successful and oftentimes not being successful.
Interesting. What you're talking about then is the idea that family dynamics and the ways in which children communicate with their parents can make a huge difference relative to what may even be going on in terms of food insecurity. Really important to understand that, I think, as we look at food insecurity. So the next question is very interesting to me because I'm wondering where in the U.S. is food insecurity in children most prominent?
Well, food insecurity as experienced by children is across the country. Food insecurity is closely related to resources that families have, so to poverty, to income, but also can be related to other constraints on families' resources. And so wherever those problems exist, food insecurity can be there. But we know from national data that about 14% of U.S. households with children were food insecure sometime during the year 2019, the last year for which we have data. The new data are being collected right now, actually. The prevalence of food insecurity in the U.S. is highest for households below the poverty line. That's about 35%, so a little more than a third. And for for households that are headed by a single woman, by a single mother, the prevalence there is about 29%. So those are about more than twice of what it is for the U.S. average. It varies across the states. The lowest is in New Hampshire at about 7% in 2019, and the highest was in Mississippi, about 16%. And the states with the highest prevalence tend to be in the South, not every southern state, but most of the southern states, and also a set of states in the middle, eastern middle, Ohio, Kentucky, and West Virginia. And going along with what we know about poverty, that the prevalence of food insecurity is somewhat higher in urban areas and also rural areas when you compare it to suburban areas, where suburban areas, families tend to be a little bit better off.
Very interesting, and much higher percentages than I might have thought. So my final question related a bit more to policies. I'm wondering what policies or programs currently help and might actually further assist in alleviating this problem.
Well, in the United States, we need to start with the important programs that are provided by the federal government. Some of those are directed to families, such as the Supplemental Nutrition Assistance Program, what used to be called the Food Stamp Program, and the Special Supplemental Nutrition Program for Women, Infants, and Children, which serves women who are pregnant and lactating and young children up to age 5. So those programs are directed to families. There's other programs that are directed to children themselves, so the school breakfast and school lunch programs. There's a summer food service program and the child and adult care program. And then there's 4 others that are, all of these are under the auspices of the Food and Nutrition Service, which is part of the U.S. Department of Agriculture. We know that the Supplemental Nutritional Assistance Program, food stamps, especially is highly effective and responsive to needs. We saw that during the Great Recession, for example, where the food stamp program responded very well to what the needs were. And I think when all is said and done, and during this time of the COVID pandemic, we'll see evidence of the same thing. There's also, of course, private charitable food assistance, where food is distributed and commodity food is distributed through food banks and food pantries. There's meals programs, and at least in some parts of the country, there's been a upswell of backpack programs trying to provide weekend food to children using school settings as a way of delivering that. I think implications of some of the knowledge that we've generated over the years, tells us that it's because adults often lack knowledge of the food insecurity experiences of their children. This presents challenges for adults, us, who have roles as caregivers, educators, and policymakers to recognize and address these experiences in the most fruitful way. And that's why having this knowledge is important. So, the programs that we have in place help, but they don't fully alleviate the problem. They weren't intended to do that in most cases. So what might further help? What help are we trying to provide? First of all, we want to help families have the resources they need to make healthy choices. And if we're going to give food as a possible solution, to focus on healthy foods. So that means in schools and even if backpacks are given to children. One of the things we know about backpacks is they tend to be not very healthy foods. And there's certainly been an effort over the last 10 to 15 years in the United States of helping make sure that schools provide the healthiest foods that we can, because we want to prevent obesity and we want to prevent chronic disease such as diabetes. But we also have learned that offering free foods, such as a backpack program, to take one example, is not benign. And because we can sometimes have disruptions of family dynamics, we can interfere with the functioning of schools that are supposed to be providing education, but are now put in this new role. Some schools we worked in, the schools were becoming essentially warehouses for stockpiles of food. We know that children who participate in programs, in one study that we did, every child said that they felt ashamed when they were participating in a program because others would then know about their food situation at home. And so that can increase stigma. And so we should only be undertaking the giving of food when there's clear evidence that that's the limitation, that's what's needed is more food. What we really need to do is to try to be more holistic, so to develop and test, scale up interventions that are grounded in a nuanced and holistic understanding of what it is that children experience, what is it that families are experiencing, and the context in which these problems happen, and then really thinking through the mechanisms through which food insecurity hurts children and what can we do to prevent that. So some such interventions might draw on what we know about children's and parents' experiences, possibly focusing not just on giving food, but on how to support parents, employment assistance, improvements in wages, mental health services. All of these could be ways of addressing the stress and anxiety that children and parents experience when things are short. It could be helping to resolve housing deficiencies. In some cases, it could be things like, well, people have a broken refrigerator and so they can't stockpile food for the week the way they would like to. So maybe that can be changed. And in some cases, we saw this during this COVID period where we need to have improved access to transportation. For example, in places where public transportation went offline, food insecurity increased because of that. So we have to try to be really thoughtful about these, all the while acknowledging that families do have capabilities and we need to help them sort of potentiate their capabilities. So in the United States, kind of in summary, we want to do proper targeting of interventions because the reality is most children in food insecure homes don't really need additional free food. What is needed is parents and families and helping systems that provide them with a range of resources and opportunities to strengthen their families and enrich their family functioning and thereby, nurture their children's nutrition and development.
Thank you so much. Very, very nice summary. Making sure that we target appropriate concerns and look at this as more than just food per se, and then writing policies that are very specific that include some of those ideas seems very important. And it seems as though you have done a lot in your research to identify directions that we need to focus on as we're looking at food insecurity. So thank you for the work you've done in this area of research. It's incredibly important, I think, to the future of our nation. And we so appreciate your comments today.
Okay, well, thank you very much. It's always a pleasure to work with you, Linda.
Thank you. Thank you so much. For more information and research on this topic, check out the January 2021 USDA supplement to JAND on food insecurity at jandonline.org/supplements.